Hello students, welcome to EPG Parshala. I am Satwanti Kapoor from Department of Anthropology, University of Delhi. Today I am going to speak on the module Reproductive Health and Anthropology from the paper Applied Anthropology. The learning objectives of these modules are 1. To study the definition and scope of reproductive health. 2. To understand the indicators of reproductive health. 3. To study the relationship of reproductive health and anthropology. First of all, we will discuss briefly about what reproductive health is. Introduction. To introduce the topic, reproductive health is an indispensable ingredient of health and a major determinant of human development. Reproductive health plays an important role in the health needs of a population. The World Health Organization (WHO) defines reproductive health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity in all matters relating to the reproductive system and its function and processes. This definition implies all people should have satisfying and safe sex life, the capacity to reproduce, as well as the freedom to decide if, when, and how often do they do so, and access to appropriate healthcare services that enable women to go safely through pregnancy and childbirth, thus providing couples the best chance of having healthy infants. Maternal health contributes most of the reproductive health. Maternal death and reproductive health can only be addressed by empowering women and girls and protecting their health, well-being and rights, including their reproductive rights. Definition and scope of reproductive health. Now, reproductive health is a lifetime concern for both women and men from infancy to old age. Evidence do show that reproductive health in any of the life stages has profound effect on one's health later in life. UNFPA in 2015 continued to support programs tailored to different challenges people face at different times in their lives, including comprehensive sexuality education, family planning, antenatal and safe delivery care, services to prevent sexually transmitted infections including HIV, and services facilitating early diagnosis and treatment of reproductive illness. This includes breast and cervical cancer. Reproductive health care involves information, education, communication, services to adolescents, discouraging practices like genital mutilation, prevention and management of gender violence, prevention and treatment of sexually transmitted diseases, treatment of obstetric complications, and safe termination of any unwanted pregnancies, promoting safe motherhood, and education and provision of clinical services for family planning according to WHO 2006. Now, economic status, gender, education, and social status were found to be the predictors in the use and gaining access to reproductive health care in India, SENIN 2013. Now, reproductive health indicators, like every good health or bad health, there are several indicators or risk factors. So, similarly, we have some for the reproductive health. One of the Millennium Development Goal is advocated towards reducing maternal mortality and achieving universal access to reproductive health care. WHO and partners including UNFPA conducted considerable work to define indicators of sexual and reproductive health. A WHO document providing guidelines for data collection, for data analysis and data interpretation of these indicators was published in 2006 by WHO. The 17 indicators so found addresses the main aspect of sexual and reproductive health and provide a list from which indicators can be selected. The reproductive health indicators are as follows. First, total fertility rate or TFR, contraceptive prevalence rate or CPR, maternal mortality ratio MMR, antenatal care coverage, percent of births attended by skilled health personnel, availability of basic essential obstetric care, availability of comprehensive essential obstetric care, perinatal mortality rate PMR, low birth weight prevalence, positive syphilis serology prevention in pregnant women, prevalence of anemia in women, especially during pregnancy and lactation, percent of obstetric and gynecological admission owing to abortion. Next is reported prevalence of women with FGC. Next is prevalence of infertility in women. Next, reported incidence of urethritis in men. Next, 16, HIV prevalence among pregnant women. 17 is knowledge of HIV related prevention practices. These indicators, however, are not specific for measuring access, nor do they provide a framework to address all aspects of sexual and reproductive health systematically. These indicators are modified according to local contexts, both in developing and developed countries setting. In the year 2006, as per the request of the UN to the Interagency Expert Group IAEG to identify relevant indicators, the IAEG proposed a core set of indicators for the new target of universal access to reproductive health, which includes contraceptive prevalence rate, unmet need for family planning, adolescent birth rate, and antenatal care attendance. Another important factor is reproductive health, a life cycle approach. Now, reproductive health is a lifetime concern for both men and women, as stated earlier also, from infancy to old age. Taking a life course approach to the study of reproductive health involves investigation of factors across life and also across generations. Evidence shows that reproductive health in any of these life stages has a profound effect on one's health later in life. UNFPA supports programs tailored to different challenges people face at different times in their lives, including comprehensive sexuality education, family planning, antenatal and safe delivery care, postnatal care, services to prevent sexually transmitted diseases including HIV, and services facilitating early diagnosis and treatment of reproductive health illness, including breast and cervical cancer. The figure here illustrates the maternal mortality rate in different countries of the world. It shows that Kenya had the highest maternal mortality rate and Japan has the lowest maternal mortality rate. Now, maternal health is another area where much more needs to be done. Poor women still die in huge numbers from the complications of pregnancy and childbirth. According to UNFPA, 920 women die for every 1 lakh live births in sub-Saharan Africa. In Europe, by contrast, the figure is 24. It is given clearly in the figure. However, these numbers are at best only rough estimates gleaned from hospital statistics. Many women go to unaccounted for because they never reach the healthcare system for treatment in first place. The figure here illustrates the maternal mortality rate in Southeast Asian countries. Sri Lanka has the lowest maternal mortality rate, whereas Bangladesh has the highest maternal mortality rate. Good antenatal health care is vital to reduce maternal sickness and death. So are cheap and simple drugs such as oxytocin to prevent hemorrhaging during birth, trained midwives or birth attendants, as they are known in medical parlance, help too. And so do local emergency obstetric centers that can handle complicated deliveries. Some countries like Sri Lanka have managed to cut maternal mortality by careful spending on such measures. The challenge is to translate these successes to other places. The figure here illustrates the maternal mortality ratio in India, EAG and Assam, southern states and other states per 1 lakh live births. The maternal mortality ratio from the year 2004 to 2013 was found to decline in all the states across India. Maternal mortality ratio at all India level was 167 in 2011 to 2013. Kerala was found to have the lowest maternal mortality ratio. Assam has the highest maternal mortality ratio. The tools for family planning, sexual and reproductive health was given an international consensus definition at the International Conference on Population and Development ICPD in 1994. A plan to achieve reproductive health and rights for all by 2015 was drafted at the International Conference on Population and Development ICPD. The plan was wide-ranging, from more contraceptions and fewer maternal deaths to better education for girls and greater equality for women. Besides these targets, the ICPD plan also aimed to change the way those at the sharp end of making policy and delivering services. It wanted to move away from focus on family planning and, by extension, government policies on population control towards a broader view of sexual health and systems and services shaped by individual needs. It was also felt that sexuality and reproduction are vital aspects of personal identity and are fundamental to human well-being, fulfilling relationship within diverse cultural contexts. Sometimes a high birth rate is a result of people wanting larger families, but often it is due to a lack of affordable contraception. UNFPA estimates that 137 million women who want to use contraceptive cannot obtain it. Though contraceptives are not regular requirement for reproductive health, one is forced to use them to avoid pregnancy or to delay or space pregnancy. Medical termination of pregnancy is legalized in our country. MTP is generally performed to get rid of unwanted pregnancy due to rapes, casual relationship, etc. As also in case when the continuation of pregnancy would be harmful or even fatal to either the mother or the fetus or both. Now, various methods are now available to help such couples who are unable to conceive or produce children even after 2 years of unprotected sexual cohabitation. In vitro fertilization followed by transfer of embryo into the female genital tract is one such method and is commonly known as test tube baby program. Various contraceptive options are now available, such as natural, traditional, barrier, IUDs, pills, injectables, implants, and surgical methods. Reproductive health, Indian scenario. In India, reproductive health status of men and women is inextricably bound with social, cultural, and economic factors that influence all aspects of lives. It has consequences not only for women themselves but also on the well-being of their children, including the functioning of household and the distribution of resources. The tribal women fulfill multiple productive functions in addition to bearing children and performing household chores. Therefore, reproductive health in a society forms a crucial part of general health. India was amongst the first countries in the world to initiate the program of family planning in 1951. Improved programs covering wider reproduction related areas are currently in operation under the popular name Reproductive and Child Health Care (RCH) program. Health and education of young people and marriage and childbearing during more mature stage of life are important attributes to the reproductive health of a society. Now, maternal nutrition during pregnancy is also essential for good reproductive performance and maintenance of a pregnant woman's health, and that the diet should be with adequate protein and calories. The other area which needs to be focused reproductive health is that till date there are many tribal communities where majority of childbirths occur without the help of a skilled assistant defined as a midwife, nurse trained as midwife, or a doctor at some or in other non-hospital settings. Now, presence of a professional attendant at each birth can lead to a marked reduction in maternal mortality and morbidity. Now, men's role in reproductive health. It's a very important factor again. Before the advent of the oral contraceptive pills, men were more involved in family planning and other aspects of reproductive health. Then, if a couple wish to periodic abstinence and condom use, all practices which require men's participation. Hormonal methods for women and the subsequent development of IUDs and modern surgical sterilization fostered the development of family planning services community focused upon women rather than men. The shift in focus on men's reproductive health was influenced by the 1994 CARO ICPD action plan to promote gender equality and equity, empower women and improve family health in society. Now, changing and improving the way in which men are involved in reproductive health can only have a positive impact on women, men's, and children's health. Educating and counseling men about contraceptive choice is essential if they are to be supportive of women's reproductive health. Obstacles include men's reluctance to use services, lack of knowledge among men about their own and women's sexuality, lack of communication by men about sexuality in their relationship, male benefits in sexual myths, health providers and false assumptions, and generalizations about men. There is a need to encourage men to support women's contraceptive choice, to increase communication between partners, to increase the use of male methods, to improve men's behavior for the prevention of STDs, to address men's reproductive health need, and to encourage men to become more aware of related family issues. Nodong and Finger, 1998. Indian tribal men's lack of participation in reproductive health not only damage their own health but also contributes to the reproductive ill health of their female partners and children. In India, the involvement of men in such matters is a new concept. Men are recognized to be responsible for the large proportion of reproductive ill health suffered by their female partners. Lack of knowledge, non-availability of acceptable contraceptives, and lack of services with quality of care deters man from sharing the responsibility in reproductive health matters. Misinformation regarding male sexuality and limited availability of scientific data contributed less involvement of men in reproductive health. Thus, various strategies are implemented to increase men's awareness of reproductive health and the accessibility of products and services. These strategies include increasing contraceptive option for men, supporting women's contraceptive use and choice, improving sexual behavior and safe sex practices, and narrowing the gender gap for better fertility control. Moreover, extensive research is required in order to understand men's perception and needs about fertility regulation and sexual behavior as well as service development. Puri et al. 1999. Reproductive health and anthropology. Now, anthropological work on reproductive health draws upon disciplines of public health, demography, biosocial approaches, cultural and historical approaches, etc. Some of the earliest work to describe ethno-physiological understandings include Ashley Montague, 1949, work on understanding of conceptions, fetal development, and embryology among Australian indigenous people. Likewise, Malinowski, 1932, in Solomon Island, and Margaret Mead, 1928, in Samoa may be seen as antecedents to modern work on the subject of sexuality, which is a component of reproductive health. Early work on reproductive customs include Ford's 1964 comparative work listing beliefs and practices in 64 societies. In the last 30 years, studies focusing upon reproductive health have grown exponentially. Concern over the issue of world population growth in the late 1960s and 1970s spurred increased interest among anthropologists towards involvement into population issues and reproductive issues. Kapoor and co-workers 2012 with the help of anthropometry found significant association of low birth LBW newborns with maternal nutritional status and age. This further highlights the importance of maternal health and the significant role of anthropology in reproductive health. Now let us summarize the module. Reproductive health is an indispensable ingredient of health and a major determinant of human development. Reproductive health plays an important role in the health needs of a population. The concept of reproductive health recognizes the diversity of the special health needs of women before, during, and beyond childbearing age, as well as the needs of men. World Health Organization (WHO) defines reproductive health as a state of complete physical, mental, and social well-being, and not merely the absence of a disease or infirmity in all matters relating to reproductive system and its function and processes. Reproductive health is a lifetime concern for both women and men from infancy to old age. One of the Millennium Development Goals is advocated towards reducing maternal mortality and achieving universal access to reproductive health care. International agencies consented for 17 indicators to monitor the reproductive health goals. It is also a matter of concern for early pregnancy and childbirth as it is the leading cause of complications and death for 15 to 19-year-old girls globally. Medical termination of pregnancy is legalized in our country and is generally performed to get rid of unwanted pregnancy due to rapes, casual relationship, etc. And also in cases when the continuance of pregnancy could be harmful or even fatal to either the mother or the fetus or both. India was the first nation in the world to initiate family planning at national level to attain a reproductively healthy society. Till today, reproductive health status of men and women in India is inextricably bound up with social, cultural, and economic factors that influence all aspects of our lives. It has consequences not only for women themselves but also on well-being of the children, including the functioning of household and the distribution of resources. Before the advent of the oral contraceptive pill, planning and other aspects of reproductive health, men have a pivotal role in the reproductive health of women since the advent of STDs, including HIV and AIDS. Anthropologists have ventured into the field of reproductive health since the early 19th century. Anthropological work on reproductive health draws upon disciplines of public health, demography, biosocial approaches, cultural and historical approaches, etc. Thank you very much.